a very special topic. But before we introduce the guests, we want to just take some time to really extend condolences to the families of those who have lost loved ones recently, especially due to gun violence. And so the team at Motion to Adjourn just wanted to acknowledge and to say sincere condolences and to extend our support to the community and all those who are grieving. So you want to have anything to add to that, MP?
Yes. Good afternoon, Bermuda. Good afternoon, Miracle Child, DJ LT. Our two special guests who will introduce in a second. Especially want to give a shout out to the families of Miss Faye Haywood, mother of Senator Lauren Haywood, Lauren Haywood Bow. Shout out to the family of Mr. Gene Simmons, the father of Senator Lindsey Simmons, and Mr. Abbott is the father of Alex Abbott, who is the deputy chair of PLP, and many others that have passed as well. But yes, you have our thoughts and prayers as always. Today we are going to be talking about a topic that potentially affects half of Bermuda. Half of Bermuda hypothetically are males, maybe a little less, but half of the males in Bermuda potentially can come down with something that statistically affects 1 out of 8 or 12.5 males worldwide, and specifically for those of us who are of color, it affects 1 out of 4. Or what percentage is that, Dwayne? 25%. So, what we're talking about today is prostate cancer. And in the studio we have Mr. Rydell Painter. Did I pronounce that properly?
You got it right.
Mr. Rydell Painter. And for now, I'm not going to use your official name because you're just a brother today, right?
Yeah.
Mr. Diallo Rabain.
There we go.
Good evening, gentlemen. How are you?
Good evening, Chris. Good evening, Dwayne. Good evening. How are you?
Okay, so just really quickly, if without obviously getting too personal, would you be willing to just share a brief overview of, your run-in, I should say, with
Call it a journey.
Journey, yes, your journey dealing with, prostate cancer and, coming out on the other side of it, and I also want to say on the air before you guys answer that, Mr. Rabain, we're doing Mr. Rabain today, I think that you coming out as a public official, though you're not here in that capacity today, to speak on your journey publicly in the press like that, I want to commend you for having that strength to do so, especially in the position that you occupy. And regardless of the politics or differences, I just wanted to say that right off the bat. So either one of you can answer.
Call him Mr. Paynter. I look up to Mr. Paynter, and so I serve deference.
Yeah. So basically, I'll speak about my journey. I was diagnosed in March 2002, and I had a prostatectomy, my prostate removed on July 21st, 2009. So sorry. It was March 2009, and I got it removed in July 2009. I never had any symptoms. I didn't even think about it. What happened is, and at the time, I was 45, and you weren't typically screened until you were 50. So, literally speaking, I did some homework this morning. And I looked at my prostate results, the examinations, I may not have been here if I would have been screened at my regular time. I got screened early due to I'm a diabetic. And the doctor that I had at the time literally threw in a PSA, said, let's see what it looks like. So it wasn't above my threshold for my age, but it was quite high. So what happened, we waited another 3 to 6 months, and then we did another one, and it was still high. And then I got referred to Dr. Diallo, the urologist, and that's when my journey begun. It was a wait and see. It wasn't. It was just eliminating. So first it was the dreaded finger exam that we talk about. Mm-hmm. Then it was an ultrasound, not like you see on TV with women no ultrasound. It's an invasive ultrasound. Mm. And then there was a biopsy. So all these came back negative until they did the biopsy. When the biopsy, so basically it's a probe, and they actually take samples of your prostate. And the right side was clear, the left side had cancer. And at that time, that was when my journey began. So I was fortunate enough to, I didn't go the usual route up in the upper northwest in the U.S. I actually went to Florida because I was doing some business and stuff out of Florida, and had a lot of, I actually had a doctor in Orlando, in the Orlando area, Lake Mary actually, and I wanted to go somewhere where somebody who knew me in the event that something went wrong or whatever. So it was a comfort thing. But I guess the grace of God, I ended up with Dr. Rydell Patel. And he, as far as urology is concerned, he's like the Michael Jackson or the Prince of urology. All the urologists know him. He actually teaches the prostate operation to other doctors and stuff like that. So just by chance, but this is the doctor that I had. His practice and everything else was great. We were on conference calls with me and my wife, prior, during, and after. There was education classes and everything else. Really, really good experience, and I basically did what I was told. So a lot of the misnomers about having prostate cancer, impotence, incontinence, and all the rest of those type of things were real concerns. But because I followed everything by the book, and I happened to stumble on one of the best in the business, I had a good journey. And that we're talking about 15 years ago. I'm cancer free, and I've been working with Prostate Awareness Bermuda to support other men and their families during when they enter their journeys.
Congratulations. Thank you. Yeah.
For me, Dwayne, it was my diagnosis was last year in November, towards the end of November. It was incredible for me because like Mr. Paynter, I didn't really have any signs. I got my regular exam. The previous year, my PSA was what we would consider elevated, but it wasn't based on the old rules. It's not something you really worry about. And but I opted for, and that was the first time I'd actually had a rectal exam, and it was like, there's nothing there. But we did a ultrasound anyway. It was like, there's nothing there. And so when I came back this year, last year for my annual exam, my PSA levels were slightly higher. And so the recommendation was a MRI. So I went to the hospital, I got that. And that's when I first met Dr. Mack. And he saw it, and he said, it's nothing really there, but to be safe, because he's now, he's been really pushing for prostate cancer awareness locally, and really, bringing awareness to it and the things you should do. And his take was, because, you're a black male in Bermuda, let's be extra cautious.
Right.
And so and like I said, like Mr. Paynter, no signs or anything. So I had a biopsy done, and my biopsy came out, and you heard Paynter say half of my biopsy, they took 6 samples from different regions. I think it's 6 or 8 from different regions, but it covers the entire thing. And mine came back, it was either 7 of 8 came back positive for intermediate aggressive prostate cancer. And so the biggest thing, and after he had that conversation and we talked about it, was really catches you off guard. You can't be prepared to hear that, you have a potentially life-threatening disease. You just can't prepare for that. I mean, I knew, you kind of know, it's like, wait a minute, he's called me, he said, come see me, it's really important, come see me, as soon as you can. And you're like, well, what's going on? And so it was funny how he explained prostate cancer, Mac, because he's probably the most. His bedside manner is bar none. I mean, like, this guy just really makes you feel comfortable, right? And he explained it. He said there's 3 types of cancer, and he said you have think of one as old, but think of one of them as an old man. They get around, they sit, they don't really do nothing. That's how he explained it to me. You know, every now and then one might wander to the kitchen, get some, but you know, they're just sitting off talking. Then you have middle-aged one, where you're kind of in the oil, you're kind of sitting there relaxed, but more, or you know, you're probably gonna have more of you that want to wander off somewhere. And the other type is, think of toddlers. They won't stay still; they'll go all over the place. And so that's how he. So I had between toddler and middle-aged, and so when you have that, the chances of it progressing beyond your prostate is really increased, and that's where the danger comes from.
Right.
Is the cancer moving from your prostate into surrounding tissues, and that's where most men will perish from this, because it's not the prostate cancer itself; it'll be the cancer moving on to other things. And so we had the conversation. I chose to have a prostatectomy. I can never say that word properly. Prostatectomy. I can never say that word properly. Right. And the same thing. He actually gave me choices. It was like, you know, where do you want to go? You know, because there are many places that do it, and so I chose Hopkins because I knew people in the area, and I thought it'd be an easier run for me. And I had, again, world-class surgeon that did my work, and even in the guy says, you know, really just December, and you know, you hear 15 years, and you hear, you know, 6 months, and it was like, doing stuff and getting out and doing things, and so that's the part that I really want to let men know, that life doesn't end. Right? It absolutely doesn't end. You're not going to be able to do some things that you want to do, that you're used to doing right away, but that will come. Eventually it will come. Stick to your exercises, stick to, you know, doing the things you need to do to make your body healthy, and those other things will come. I said in my interview before, I said, you know, I'm healed physically, but mentally it's still, you know, the scary part of, you know, not thinking of not seeing my daughter grow up, you know, not being around for those important moments. You know, it's like, wow, you really got there. And so every now and then you attempt to do something that you just normally did without thinking before, and you're like, oh, I do know I have this restriction that I'm working through. And so most men are scared of not only just the rectal exam, but it's well known that the diagnosis from prostate cancer and is incontinence and erectile dysfunction. The 2 things that men don't want to ever talk about. Right. Even in this journey, I've talked to persons, you know, older than me, and I'm like, hey, if that ever happens to me, I'll just ride it out. You know, live the good life. Like, don't take that away from, you know, sort of thing. And I'm like, but guys, it's something that it doesn't have to be like that. And especially, like I said, I think Dr. Mack has been a godsend for us in Bermuda. Absolutely. I don't think people really realize how much this guy has put this disease on the map, how much this guy has gotten insurance companies to pay attention, because before him, you know, you couldn't get insurance for the medication you needed. You couldn't get insurance for the operations you needed. Wow. You know, it was different when it came to, because a lot more was known about breast cancer. And so there were more, you know, there was much more support around that. But this thing was, I mean, a lot of it is, from now listening to the guys, a lot of it is about us just suffering in silence. Yeah. You know, not really wanting to get out there. So that's why I made the decision. And I told, you know, anybody who will listen, when I'm well enough, you'll hear me speak, because this is something that could save us, especially us as we're already an endangered species as black men. You know, that's right. Why not why not give people the information to save their lives? You know, and not necessarily have to go through, you know, a painful, you know, existence, when there are ways that you can nip this in the bud.
Thank you for that. And I think you kind of answered the second question, but for you, Mr. Paynter, you know, what made you?
Mr. Paynter was my old man.
Yes. Right. What made you, you know, come forward and advocate for this? Because I believe Diallo answered that a bit in his first answer, but for you, what made you come forward?
Well, for me, it was kind of it's ironic you should say that, because this morning I got a WhatsApp from one of my mentors. I've been blessed in my life to have many mentors in different walks, from the union, from technology, from clubs and different. I've had a lot of good mentors, and I got a WhatsApp about a friend of our colleagues that has recently passed, and she was telling me that she didn't know and everything else. She had breast cancer, and she was very open about it, and she basically was very aggressive and dealt with it. She actually had a double mastectomy, and she had this face and thing about it was amazing. And as one of my mentors and seeing how she operated, it's just something that, and this was maybe 30 years ago, before I even cancer wasn't even in my thing. So when I met a woman that had a breast issue, I could introduce her to that person, and she would talk to them about their journey and what blah blah blah. So that was the seed that was planted in me from my mentor. When I got diagnosed, I reached out to one of my partners, another founder member of Prostate Awareness Bermuda, Dr. P, Norman Pogson, because I knew that he had prostate cancer and he was open about it, and he basically came to my house and talked with me and my wife about his journey, what to expect, the down and dirty, no holds barred, what to expect and everything else, and that was greatly appreciated. So that was the thing that kind of is like a pass it on type of thing. So it's like people have followed me, and whenever I do talk to somebody or somebody comes talk to me about it, they say, hey, thank you, what I could do. I said, just pay it forward. Just pay it forward. That's what it's about.
Yeah, and I appreciate that answer. And just for you both, what are some of the most common, misconceptions that you've both run into having gone through the process and coming on the other side when folks are speaking to you or just in conversation?
I think the biggest for me is kind of like it's a death sentence.
Yeah.
People, when you hear it, and that's why it's always advisable when you get diagnosed to have somebody with you, a significant person, other, because when the doctor tells you that, it's kind of like Charlie Brown, wah, 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 you don't hear it, you're in shock, and having someone there to take in everything and question and everything else and kind of bring you back, because for some men it doesn't just from the diagnosis, it's a shock that lasts for a little while. So having somebody to support, and that's a thing that like Prostate Awareness Bermuda is about supporting and being there. We're trying to educate men to understand, if you get on this journey, then these are the questions that you need to ask. Dr. Mack, as Dr. Macanjola, as Diallo has said.
Got away from me there.
Yeah. No, I was going to remember. Anyway.
Yes, I got you.
Yeah, as we are one of the first jurisdictions to actually have a prostate guideline, and that is something that other jurisdictions are now looking to actually implement, which is a guideline on questions that you should be asking and different things like that. So when Diallo says that Dr. Mack is a godsend, it's an understatement, really, because the amount of stuff that him, Daily Mail have done for this island, the free screenings and all the rest of the things. So we're trying to take the excuses away from men. Men always don't want to go to the doctor. They don't want this. They don't want. I don't have insurance. Okay, so Daily Mail will give you free screenings. So what's happening? I don't want the finger. Okay, you could get an MRI. So we're just trying to
That's a big one.
Continue to educate people and understand that it's not a death sentence. And like I said, I'm living proof. And you got people that are older than me that are still around and stuff like that. So that's the biggest one, I would say. And then comes the incontinence and the erectile dysfunction. And that is dependent upon sometimes pre-existing issues. Mm-hmm. So if the prostate sits in a capsule, and if the cancer does not get out the capsule, and it doesn't affect the nerves outside of the capsule, then your likelihood of having permanent erectile dysfunction is limited, is minimized. So the idea of the operation that we've had is what's called nerve sparing, because the nerves is what actually gets the blood flow and allows you to have sexual function. These are the type of things that, you have to be mindful of.
A few questions have come in via WhatsApp. Thank you to those who have sent them in. The first one is directed to you, Mr. Painter. And it says, Rydell worked with prostate survivors for many years in the end-to-end. Ask him to tell that story and if it will continue.
The end-to-end was actually, ironically, my first end-to-end was in 2009. So that I was actually doing a lot of prep work and actually doing a lot of miles for the 24-mile walk. And that was one of the things that helped my surgery, because of the fact that I was relatively fit, and the exercise of walking is even post-op, walking is a vital part of your recovery. So walking is something that is definitely encouraged, and it was a big part of my existence and my operation.
Okay, thank you for that. Another question that's come in is, did either of your guests have family history of prostate cancer?
I don't think when I was diagnosed, I don't think that I have like generation in front of me, but I think one of my uncles may have had prostate cancer that I didn't know about at the time, but there wasn't any history. But one of the things that I've done with my children is to make sure that they get screened, because the likelihood, because of me, they have a higher risk.
Are they? You don't look old enough to have children that are 50.
45.
So this, no, I wasn't saying it. I said it kind of jokingly, but what would you say is the earliest someone should get screened?
Well, before the mark was 50. With recent developments, technologies, and everything else, they've pushed it down to, it was 45, and now it's around 40. And if the youngest person that we knew about in Bermuda, in our team, in the Prostate Awareness team, was 38 when he was diagnosed, but he had a family history of it. So it's something that you have to be mindful of. Also, the other thing that is a relatively new development is the relation between breast cancer and prostate cancer. So once upon a time, it was like if my father, uncle, or male had prostate, then it was also it's been found with the BRCA2 gene that causes that's prevalent in breast cancer. So if you have breast cancer in your family, you still should be screened as well.
Yeah, because I think the unfortunate reality, whether it's because of increased diagnostic skill or any number of variables, the incidence of cancer amongst people is actually rising. Right? It could be the food we're eating, the toxic environment. I mean, physically, not your job, but the actual atmosphere. So I say that in the sense that for women and men, for women, what I understand, some women don't want to get a mammography because it hurts or something like that. And one of the things that we've done over years as a society is destigmatize cancers, in the sense to say, oh, you got cancer, okay, I can't come to your house, you got cancer, right? Whereas now we have, during October, everybody wears pink or whatever, you have this awareness, and women are more encouraged to go get mammography, check your tatas. I didn't say that. No.
Sunrise your tatas.
Right, right.
Yeah.
Yeah, I said tata.
I'm just checking.
Come on, look at this guy. But the point I'm getting at is that the more we talk about it, and we realize it could be any one of us, right? It's 4 of us in a room, and so far 2 have been diagnosed, right? Any one of it could be Dwayne, could be myself. In the next couple of weeks, days, whatever. I get my annual done, and the doctor could be calling me, and so I'll be leaning on you, gentlemen. Somebody. The thing is that we have learned to be supportive of each other in our journeys.
Absolutely.
Right? And that's why I'm grateful for you gentlemen coming in today, because when I sent out the WhatsApp, I sent out locally and I sent it out regionally, meaning the Caribbean. And a lot of folks text back and they say, thank you. Matter of fact, I had a brother in Barbados text me back and said his lodge was starting prostrate awareness in Barbados, right? So these are the things that as we mature as a society, we have to talk about it openly. Because the more you talk about it openly, the more persons realize, hey, that could be me. Let me go get checked. Or if it is them, they realize that they have a support system, right? I didn't know about what's it called?
Prostate Awareness.
Prostate Awareness.
Bermuda.
I didn't know about it until you sent me the flyer, right? So these are things that I am grateful that you all came up, and we have to continue this as a discussion. I mean, yes, as a country, we got to worry about the cost of living, worry about housing, we got to worry about, who's going to be in cup match. But all of that's kind of irrelevant if I have to carry one of you all prematurely, if I have to be one of 6 or you have to carry me, that could have been avoided had, or I shouldn't say avoided, but what can I say, postponed.
Well, Chris, you saw that was what I didn't say it in that way, but it became the headline of that article I did with the RG, where it said you can't be the man of the house if you're 6 feet under. Right. And I think and Chris, you mentioned about the support group. I mean, it's on tonight. Actually,
it's 6 o'clock.
It's on tonight. And the fact that you're sitting there with men who and not everyone has prostate cancer. They just have prostate issues, and some people just have prostate questions.
Right.
And the ability to actually hear. I know the last time that we met, and I had told my story, it was someone that I knew, that I've known for a long time, and they were at the stage I was when I was waiting for my results. And so it was they told me afterwards, it hit me up, like, it was very nice, very good to hear, how you went from waiting for your results, getting them, surgery, so I actually have an idea of what to expect, what to look forward to, and those sorts of things. But just listening to men talk about their journeys. One thing that I have gotten from this is everybody is about similar up until surgery. In our boat, it's the recovery that you just can't predict. Some people take years, some people take months, some people take weeks. I mean, for me, I have almost zero issue with incontinence, and I'm just over 6 months, which, according talking to guys there, is like that's like a miracle. But
there's advancents in technology.
But that's what I'm saying. But now, and then they're also saying, but you had your surgery this way, I had my surgery this way, and and we compare and talk about how it is done. I mean, the robot thing is just it's just crazy. Coming wheeling into the room, they show you this thing. And it's these arms, and he was like, "What do you want to name it?" I said, "Oh, I'll name it after my daughter because I know she'll take care of me."
Yes, I like that.
So it was, and literally 2 hours afterwards, they're like, "You got to get up and start." You mentioned walking is important. You got to get up and walk, and you're in pain, but you know what you want that end goal to be, and it wasn't as painful as I envisioned it to be. Quite honestly, after those first 2 weeks, after the catheter comes out, after the catheter comes out, it's nothing pales, nothing compares to that. But once it comes out, you actually kind of, you actually gotta like slow yourself down because you're so used to. Because I would reach for something like, oh, I remember I'm not supposed to reach, that sort of thing. But the advancement nowadays, and talking to guys who went through like the full surgery, where it's the surgeon there with the knife and everything, it's phenomenal. And again, I reiterate, or thou reiterates, you don't have to suffer in silence. If you just want to talk, come out to the group. If you just want to, hail up anybody who's there. And I think one of the biggest surprises I've had from this and coming out and being very vocal is how many people have come to me and said, well, yeah, I've suffered through that.
Yeah.
Who
I learn.
and who I would have never known. Now I'm talking about brethren.
Yeah.
Who I'm cool with. We talk about everything else on this song, but never have talked about that.
Yeah.
Yeah. And when does Prostate Bermuda meet?
So Prostate Awareness Bermuda meets the second Thursday of the month at Blue Water St. Angeles at 6 o'clock.
Hey, nah.
So we'll be leaving here and going straight down to the meeting will start and everything else. So it's a monthly meeting. And just a little bit of history about prostate. We decided to call ourselves Prostate Awareness Bermuda versus Prostate Cancer Bermuda because we realized that there are other issues with the prostate, like enlarged prostate and various other things that have that can occur, and we wanted to make sure that we didn't exclude anything else. So right now we're talking about particularly about cancer, but there's also other issues that can enlarge prostate. People getting up and urinating 20 times a night and different other things that are all related to prostate and your plumbing system.
Right. And I mean, just speaking from the perspective of a fellow who hasn't seen as many seasons, we can be a bit more bullheaded when it comes to getting checkups, when it comes to even thinking about certain things, because at a certain age, you feel like you're invincible in a certain at a certain point. And so I just wanted to get you guys to speak a little bit on that masculine side and like how that may prevent some folks from, like, did you have any experiences with that when you were discussing it, or how do you think that we as a society can kind of not break through that but kind of mitigate that so folks who are younger can be getting checkups and going and getting physicals and things like that?
Well, we do Prostate Awareness has been very supportive and aligned with the Daily Mail, which is Dr. Max Group, who have done these screenings. And sometimes we have, whenever we have the clinics, we will have somebody who is mulling around and kind of debating whether to come in or not. And, one of us may go and sit down and talk and try to encourage the person, not badger them, but encourage. One of the things that we like to say is that every year, if you have a car, you have to go get it fixed up, put it through TCD to put it back on the road. Bike, you have to do the same thing annually. Take that time around your birthday, get a checkup. Give yourself a fighting chance. Because the one thing about being diagnosed with most cancers, but prostate cancer in particular, is when you're first, if you catch it early, you have like 6, 7, 8 different treatment options. Radiation, chemo, the prostatectomy, you have, but if you leave it longer, the longer you leave it, those start coming off the table. So your options start minimizing. So you want to give yourself the best fighting chance. So it's getting in early. I was fortunate, and like I said, it wasn't the only reason that I found out was because of my diabetes. I wouldn't have found, I didn't have a clue.
Right.
You just got to be as proactive to give yourself the biggest fighting chance and continue to talk about it. And like Diallo has said, he's come out and said it, a high-profile individual who's understands and gets the importance of getting the word out and getting people to understand that this is big. And it's not only for men, it's also for women who have men in their lives, fathers, uncles, and stuff like that. When we have the clinics, a lot of the people that come are literally being dragged by the significant other.
Yep.
You are going to this clinic and you will be checked, etc., etc. So is there things like that and support? Like I've been fortunate doing another thing with my journey is that my wife was a very big part of it, and she actually has supported a lot of the women or the significant others in the group when they go on journeys, so she can give the caregivers the perspective of what it's like to take care of a prostate patient. and various things like that. So all these type of things that we found out, the counseling, the talking, the just sharing. Sometimes, like Diallo was saying, you'll hear, we'll continue hearing new things, and it's like, wow, didn't know about that, didn't know about testosterone and what it does and all the rest of this type of thing. It's so many different parts, and Dr. Mack has like basically put us in the world stage, really.
So one of the common misconceptions that a lot of people have is that, if you're healthy, if you exercise, you can somewhat prevent this from happening. Would you, either one of you, speak on kind of like that misconception where, you have somebody who's fit, who's done everything right, and still they can end up with prostate cancer or any cancer for that matter?
Well, I think the clearest example is, and I cannot remember his name. He's the like 4-time Olympian from the UK, and when he finally got checked, I mean, this guy won medals, and when he finally got checked, he was like stage 4, right, and he did everything right. So I was exercising and winning medals in the Olympics on multiple occasions, and he didn't get himself checked and everything, and all of a sudden it was there. Like Rydell said, I was relatively in good shape. I got checked, and I'm diabetic as well, so I get checked every 3 months. I go to my doctor every 3 months, so I'm used to that routine. And I do time my annual checkups around my birthday. It's your birthday, so it's easy to remember. And once you do it once and you set that, man, and it's one of those things that I think it takes persons like ourselves, and I'm talking on the political sense, or persons who people hear, and they actually listen to and know, and to just be comfortable talking about these things and having those conversations. Do it in your group settings, just with your brethren. Hey, you got checked, man. I got checked. And kind of push it along like that, because at the end of the day, we just want to save lives. We want our men to know that they're healthy. And like I said, you cannot be the man of the house if you're laid up in bed or worse. You're 6 feet under. And I think as we've talked in groups like this one, it dispels some of the myths that people have attached to it. And so when you're able to talk to somebody who's your age, who you may have ran with, done things you shouldn't have done together, back in the day. They're like, okay, if he's getting to it, and I consider myself to be just like him, I can be okay too. And so it's and for me it was that, being able to come out and say, hey, you can live a okay life, you can be relatively healthy. It doesn't mean that it won't affect you. Healthy, living a healthy life does seem to reduce your chances, but still, well, what's better than knowing than just thinking?
Yeah, I agree, and I think that's an excellent answer. And the reason why I wanted to bring up that point is because you've come to a place in 2025 where you have health crazes, folks taking every smoothie, every supplement, every anything but if you're younger, going to the doctor and actually getting checked. And I wanted to get that point out because I think a lot of people believe that if I'm making those steps, I don't have to get checked up as often. And sometimes even doctors will give people that sort of advice where it's like, you're fit, you got good numbers, you can come back, biannually, or, some people might say, hey, should I get checked for They say, you don't have to worry about that till 40 if you don't, So I think it is kind of like a culture of like, if you're on this health kick, you always hear that some people, are healthy and then they end up just suddenly passing away, and people are like, how could that happen? Because they run marathons, they always drink the smoothies. And I just wanted to kind of really drill down on that point that, this is something that could be, genetic. It can be developed despite your health or your physical fitness. So I appreciate you sharing that, because I think that's going to be very important, especially with younger people. Because I remember coming up and people were like, "Oh, I'm in football, I'm in this and I'm that." I wouldn't get none of those things, and some of them ended up developing certain things. So what are some of the?
I was going to say I like the fact you talk about the van.
Oh yeah.
Now he's mobile. Dr. Mack and his van, and perhaps we could start looking at taking the services to the people.
Yeah.
And that's the idea.
That's the intention.
The intention to take it to where they are. To go to a football game. You mentioned football. Go to a football game where it's a lot of males. You know, chilling and just say, listen, all you gotta do is come here, quick little test, and you're going. Sort of thing. And then that's how we improve. That's how I feel that we can be improved, and we just get people screened.
Yeah, I think that's a good idea. And I mean, I also want to commend as well, you highlighting, Rydell, that women attend these, because I think it's a big acceptance point as well for young men. If you go to a football game, like you suggested with Duvan, and the young ladies are saying, hey, like, it's acceptable for you to get checked. A lot of young guys, because, you know, the bravado and the girls, you know, going from that route too, where women are accepting it at a young age can help as well.
Yep.
But I think there's a bigger, I won't say bigger, but there's much more support for female issues, cervical cancer, those type of things, and breast cancer and stuff. So that everything is pushed towards the female. And one of the other things that, like Prostate Awareness Bermuda and the groups that we are amalgamating with, is looking for advocacy for males. For example, right, if a lady has breast cancer and she has a mastectomy, just a single breast removed, insurance companies will pay for the removal, as well as they'll pay for augmentation and reconstruction for that, because of the stigma of only having one breast type of thing. They pay for that. For men, there are cases in Bermuda, unfortunately, where there are relatively young men who are recently married, who have erectile dysfunction. They've been through all the things, and there's nothing going to help. The only thing that's going to help them is what's called a pump, and it's basically a insertion of a device that will allow you to get an erection and then go down. But this, and it's got to the point where it's psychologically, where this individual is contemplating suicide because he does not feel like a man. The insurance companies won't pay for that.
Wow. So
Dr. Mack again has advocated, and the Daily Mail have advocated, where now there's particular cases. I think it's 2 cases that have been agreed that they will cover for that, and that's what we're trying to get everything on an even playing field. Health is health. Women's health shouldn't be up here, and men's health shouldn't be down there. It should be the same. And those are the type of things that we're going to be doing. We're going to be meeting with the Minister of Health. We're going to be meeting with the doctors and the practices and stuff like that. It's a whole lot of things that we're trying to do to get, again, have the conversation, talking about men's health, not only just prostate issues, cardiovascular, various high blood pressures, a lot of things that's in the community, and I don't like saying black, but in the black community, that we really need to address. And the only way that we're going to address those things is if we sit down and talk about them. And if your wife or your significant other's got to drag you to it, then so be it. My wife always tells me it's not when you get it, it's that you get it.
Right.
So it's like, it's those type of things. And as long as we keep on talking, things like this, I really like talking about it, because it's got to get out there to make a difference in people's lives.
And just really quickly, for either of you, do you feel like men's health is not prioritized, or do you feel that we have an issue advocating for ourselves or speaking up about what we're dealing with?
I think it's advocating for ourselves.
Yeah.
It was interesting because I reflect back on, I don't like talking about what happens in our, the group setting, but it was, the conversation was around certain medical availability of things. And it came down to, it was like, wait, but you don't have to deal with that. You could go somewhere else and get it done. And the guy was like, oh, I didn't realize that. So it's like, when it comes to males, it's like, there's like, well, it can't have it here where I normally go, so I guess it's not for me.
Right.
Not knowing that you can advocate for that and say, well, wait a minute. How come you don't have this in place for men? My wife comes here and everybody gets it, she gets it, but not me. And so part of this, and one thing I did like that conversation was listening to guys say, no, we have to advocate. We have to say, if this is what's needed, then us as a country need to start to look to provide these things. They're provided for everyone else. Why not men as well? And so advocacy on our own. We said it earlier. Men will suffer in silence. right? And you know, I've heard stories of, you know, the manager's angry, they're home, and you know they're just mad, you know, and they're mad, but they're married. The wife is just saying, "This is how it's going to be," not knowing that there's assistance, there's help out there for you to get you past those, you know, moments like that.
So just to hand over to you both to pass on any final words you'd like to impart to the listening audience, anything that, you know, is a burning desire to get out before we allow MP Famous to close it down.
For me, it's just the annual checkups. That's just a basic, and that actually goes out to everybody. That's just not limited to men, and even children. You know, get those annual things done. Don't be afraid of learning something. It's better to know so you can address it while it's in its infancy than waiting until it's gone past the point where you can even do anything about it.
Yeah. For me, it's about information. Sharing, taking the time out to pass on information so that people can make decisions. As I said, if you get diagnosed earlier, you have much more. You have many options. The later that you leave it, the options go off the table to the point where you don't have an option. You know, it's just so basically wait and see until they put you 6 feet under. Having the conversation in the clubs and stuff, men will talk about. You know, we would sit at a club and talk about everything under the sun, but we don't, as Diallo said, we don't say, "Hey, how you doing, man? Last time you had your health check," and stuff like that. So it's just bringing that awareness and making it a thing. One of the partners that we have partnered with is Carry Genetics as well, and Dr. Veldin and her group, and we've kind of trying to make. There's 2 times when you hear about men's health: Father's Day and in November, which we call Movember, which is the time that's Men's Health Month. We're trying to change the narrative. Every month we're trying to hit to basically say men's health is important 12 months a year, not just 2. So it's just getting there and embracing and being better.
Thank you.
All right. How can I put this? When you're it was one thing when you heard about somebody passing or heard about somebody sick. Yes, you know, you heard third party, oh, yeah, your boy's got this, or your boy passed away, or in fact, your boy's in the newspaper. What happened here? Right? But it's another thing when someone you consider as a brother says, hey, confides in you, listen, this is the situation I'm dealing with. And I would say this publicly, right? A few months ago, someone who's a brother to me, in many ways, said, I've been diagnosed with prostate cancer, right? And immediately my mind started twirling like, what? You're younger than me. Like, I didn't say that to them. I'm saying in my head, you're younger than me. How come you have prostate cancer? And, you know, so on and so forth. And it had all these negative connotations in my head, and I forgot I shouldn't say I forgot, but I did not properly know how to give that person the support they may have needed. All I could tell them is, look, you know I'm here for you, right? Whatever you gotta do, I got you, bruh. And that may come across in the masculine way versus the supportive way that you all spoke about, right? So I just want to say that to my brother Diallo, right? I just want you to forgive me if I was not able to properly show the support I could have done, right? But it really, it hit me like a ton of bricks when you told me your prognosis, and all I was thinking about is, well, you know, no offense to me. All I was thinking about is, well, we got an election coming. I'm gotta deal with my boys canvassing for him, and I had all these things that could help to alleviate his burden. But as men, we don't really actually tell each other, like, you know, we don't know how to show each other that emotive support. You know, you give them that hard talk, but not the
Empathy.
the empathy. So I just want to say public on the radio, you know, if I
Thanks, Chris.
If you felt at the time I didn't give you support,
Never feel that way about you, mate.
right?
We've been through far too many battles.
Yeah.
Say I love you, Dale. Just
You can say it. You can say it.
I just say it, just say it. Yeah.
Yeah.
We love you, Chris.
Yeah. Yeah. So these are the things that as men, these are things as men that we ourselves have to relearn how to show each other empathy without feeling less of a man, because just that support when he was away and he was texting me, I was like, hey, how you doing? Yeah, everything's cool. I'm coming here. I'm like, boy, ain't you supposed to be out there for like 6 months? Or, I don't know what it's talking about coming and it's talking about, yeah, I'm getting ready to hit the trail. I was like, you better, you know what I want to say, but you better chill. I got you, bro. We got this. So I say all these things. I know I don't want to purposely leave out DJ LT. You have anything you want to add? Yeah.
LA, man.
LA, sorry.
I'm used to putting in different states.
Yeah. My wife actually sent me a message and say it's one of the slowest growing cancers. Another brother texted in. He said that convey to Rydell and the minister, thanks for going public with the stories. I sent you the messages. And another brother sent a message saying that he's actually seeing, thank you for the topic, I am actually seeing Dr. Mack. He wants you to give him a call. Mm-hmm. So I say, and I see somebody else's text me, says, I pray all is well. How ironic your topic tonight. I made my appointment on Tuesday and I see the doctor next Thursday. This is somebody actually lives abroad, but they tune in all the while. Mm-hmm. So, I say that to say that we have to let our brothers know it's okay to reach out to us. Even if you want to just send a little WhatsApp on the side, send the WhatsApp, like, you know what I mean? Because we're there for you.
Absolutely.
Yeah, so that's it.
That was nice, Greg. I know it. So thank you to the listening audience and the two guests who came in to share their tremendous stories. And from the Motion to Adjourn team, we want to echo the calls to please get your checkups. Make sure to, if you are going through that, reach out to Prostate Awareness Bermuda, and
If I may,
of course,
Prostate Awareness Bermuda. You can. We're in the process of rebranding and getting out there. A website and everything else is coming, but if you want to get some information, the email address is prostateabda@gmail.com. prostateabda@gmail.com, and the cell number is 332-7936, and that's my number. And I basically admin the WhatsApp group and do a lot of admin for Prostate Awareness Bermuda. So it's reach out anytime, anywhere. And if, like Chris, if like you said, if you found somebody came to you, send them my way. That's not a problem.
Well, thank you for that, and that lets you know that the support is there, and you have a safe space if you do want to come forward and share your story or walk through that journey, if you are suffering from or at risk of, which we all are, of prostate cancer. So with that, I think that was a good one. Thank you everyone who's joined, and we may probably have to.
Some breaking news, sir.
Oh, breaking news!
Yeah, we have a new pope for those who follow that faith. But equally as important for those who follow Manchester United, V141.
Yeah, let me close. Let me close the show before people start calling in. So hopefully we'll be able to have you gentlemen back on to speak about it maybe down the line, so that we can keep the advocacy going on our platform. But thank you so much, and to the listening audience, we always appreciate you tuning in and letting us know what topics you want to hear from. And with that, We will be back next Thursday.
Hold on. Let's do this properly.
His finally track. Yeah.
We them boys. It's the proper.
We gotta work on the promotion. We gotta get you a drop for that. Like, just get your own very motion to adjourn.
We'll be back next week Thursday. Thank you all for joining us.
Thank you
Take
for
care.
having us.